Hello, everybody. I'm back. Dr. K.K. Agarwal, President, Confederation of Medical Association of Asia and Oceania, past President IMA, and President Healthcare Foundation of India. And you are watching Med Talks with Dr. K.K. Agarwal, COVID edition, 134th non-stop edition. Let's have the headlines of the day. On the occasion of World AIDS Day today, the United Nations has called for global solidarity and shared responsibility to overcome not only COVID-19 but also AIDS. Moderna has applied for emergency use authorization for its COVID-19 vaccine. Trials have shown 94.1% effective at preventing COVID-19 and 100% effective at preventing severe cases of the disease. Delhi government has capped the price of RT-PCR in private labs to rupees 800. A 30% decline in both new deaths and corona cases has been registered in the month of November. According to World Malaria Report 2020 released on Monday, India has recorded the largest decline in malaria cases in Southeast Asia region from 20 million in 2000 to about 6 million in 2019. Let's go to the topic of the day. The topic is bioethics in HIV, and I have a special guest with me from Australia. He is Professor Russell D'Souza. He is currently the Dean and Professor of Organizational Psychological Medicine at the International Institute of Organizational Psychological Medicine, based in Melbourne, Australia. And he is also with Doncaster, UK, and Melbourne, Florida, USA. He is the chair and head of the Asia Pacific Division of the UNESCO Chair in Bioethics University of Haifa. He has professional appointments to universities and colleges in Australia, India, Asia, and Latin America. He has over 80 publications in peer-reviewed journal, editor of textbook of bioethics, medical ethics, and health law, editor-in-chief of Global Bioethics Inquiry, foundational managing editor of Asian Journal of Psychiatry, and he has received Doctor of Science honorary causa from the Chancellor of SRM University, India, in recognition of his work. So welcome, Russell. But before we start, we have a customary to follow certain hygienic principles because people are going to watch. Two of us are meeting, and when two of us meet, we always do a hand hygiene practice. As a reminder to the people, whenever you have two people meeting together, make sure you have cleaned your surfaces and you have done a hand hygiene. So in a typical, say, we will do a hand hygiene. So we say Seedha, Ulta, that's a Hindi word, Muthi, Angutha, the nails, Nakhun, and then Kalai. So by the time 20 seconds are over, you can smell, you have cleaned your areas, and then we take a longer protection area and we clean all the areas around us. This contains a antiseptic which can clean for longer period of time. Now coming back to our topic, and that is bioethics in HIV. Russell is going to give a presentation, and after that, we are going to have the discussion. Russell.
Thank you, Dr. K.K. Agarwal. I'm delighted to be here. Of course, it's 12:30. It's actually the next day for me here. The second, it's already Bioethics Day is over, and it's we are 2nd of December here. So I'm delighted to share this with you. Let me just get this.
Can we have the slides, Ritu? Can you have, yes.
Okay. Can you see it now?
Yes. Just hold on. Go ahead.
All right. Can I go ahead?
Yes.
Okay. Today's World AIDS Day, and we're focusing. There are many aspects to this, but I'm going to try and focus a little bit on the ethics, given that I'm involved with the UNESCO chair in bioethics, and so let's start with an introduction. The social issues associated with AIDS can be understood in two ways. One, first, they may refer to social determinants of the pandemic, and secondly, they relate to the social impact of the pandemic. So, the ethical questions present some of the most vexing problems that we've seen associated with HIV infection. And of course, ethics cannot be considered in a vacuum. Now, the spread of HIV is linked to certain patterns of human behavior. So what we realize, it is both biological, but there's a socio-cultural determinant also present. And any attempt to control its spread must take into account the complex social, cultural, economic, and indeed environmental factors which this disease is embedded in. India, of course, has a large migrant population, and so there's been rapid urbanization coupled with poor housing facilities in city areas. All this has led to migrant laborers staying away from families. To add to that, we have illiteracy, and poor awareness. All this exposes to high risk behavior. Occupational groups such as truck drivers are particularly vulnerable. And of course, mass uprooting of people by ethnic conflicts may also be related to an increased incidence of this HIV infection. And of and then we see the effects of this HIV/AIDS multiply far beyond the infected individual, and in the long run, it has the potential to affect whole sectors of the economy and societies, as resources will be required for the increasing number of people living with this HIV/AIDS, and for the care, certainly for with the increasing number of orphans that are produced. The four pillars, now coming back to the ethics, the four pillars of medical ethics: autonomy, non-maleficence, beneficence, and justice. These are general guidelines. Of course, they leave room for interpretation and, of course, judgment in specific cases. Many of the ethical issues that confront us in the context of AIDS are not new at all. However, this pandemic has given a sharp focus to particular issues when we talk of the ethics principles, and this refers to confidentiality, discrimination, access to healthcare, and prenatal testing, abortion, and the conduct of and vaccine trials, clinical trials. Now, when you come to ethics in AIDS, ethical issues relating to confidentiality, partner notification within the context of this infection are indeed complex issues. So we see that the right of the individual to confidentiality can be a conflict, and we see the conflict with the right of the partner to be protected from the risk of infection. And therefore, we see then confidentiality is essential to prevent discrimination. On the other hand, the seriousness of the threat of the health of the unsuspecting third parties resulted in the debate on informing people at risk, also known as partner notification. The National AIDS Control Guidelines for HIV counseling encourages motivation of HIV positive persons to disclose his or her status to their sexual partner. And of course, the Supreme Court of India had ruled on the issue of the right to confidentiality of subjects with HIV infection and the breach of confidentiality in order to protect the health of the third parties. And thus, the opinion of the court notes that the right to privacy and confidentiality is indeed not absolute, and the right may be lawfully restricted in situations where third parties are at risk. Now, about testing, and you look at the NACO, the National AIDS Control Organization, has a policy that no person is to be tested for AIDS, for HIV, without voluntary consent. And of course, this NACO policy rules out any mandatory testing for HIV. It also encourages voluntary HIV testing with appropriate, importantly, pre and post test counseling. Ideally, when you talk of the risk, and importantly to remember, risk is not knowing, so we want people to get tested. Ideally, the disclosure of HIV status of the person should not in any way affect his or her rights to employment, position, to workplace, right to medical care, and all other fundamental rights. Unfortunately, one of the biggest problems faced by the HIV positive person is stigma. And people, even doctors, are sometimes afraid of dealing with HIV positive persons, leading to discrimination in medical care. This stigma can prevent people from being tested. It can result then in individuals unknowingly transmitting and the HIV and increasing. I particularly want to refer here to the Universal Declaration on Bioethics and Human Rights. Article 11 of this Universal Declaration refers to this, where the Universal Declaration, Article 11 states non-discrimination and non-stigma. And we see in particularly here that this relates to Article 11, and we need to keep that in mind. Then comes the issue of, we talked about testing. It can't be mandatory. So there is a consent for testing. And according to NACO policy, no person is to be tested for AIDS without voluntary consent. And I think I did say talk that the important thing here is that when a patient approaches a doctor of his or her own free will for treatment, there is an implied consent for the doctor to examine and perform any test which is in the best interest of the patient and thereby in her or his management. Now, HIV testing is not like any other routine test which can be done and which we continue to do, there where we have an implied consent of the patient, but instead we need a written informed consent here. This consent is to be given by the patient himself or his spouse when he or she, if the patient is unconscious or not in proper frame of mind, then we use the spouse. Similarly, the consent is to be obtained from the guardian in case of a minor. And in case of an unattended, unconscious patient, it requires at least 2 treating clinicians to decide that the test is required for the patient for more effective management of the case. Then testing cannot be done just in the interest of the treating physician's or his safety, or the physician's safety. So this is again to look at the HIV patient consent form, which is what the patient name, signature, medical record number, and here's the information part being given, and then of course the consenting part after the information is there. Now, the next important issue that we look at after we got the consent, next we talk about counseling for the HIV patients. Another issue linked to testing, which should be considered before collecting the blood for testing, is counseling. So we have a pre-test counseling, and this is done before collection of the sample for testing, wherein the subject is given a good, thorough understanding about HIV/AIDS, the risk he or she has undertaken, and what a positive result would mean in the event of the blood report turning out to be positive. And of course, during this pre-test counseling, you also prepare the patient for blood collection and motivate them for free and willful consent. The pre-test counseling is supplemented by now a post-test counseling, which is done before the test results are handed over to the patient. Now, what happens here is this gives an opportunity to the counselor to discuss once again HIV-related issues and help the patient to cope up with the test results and prevent crisis. Now we talk about this advice, consent, test, and support. An acronym used here to help with this. So you look at advice, the issues around that, consent, and test, and then support. So that comes in there. Now we were talking about confidence. One of the critical issues is confidentiality, and so we look at the HIV infected individuals. Confidentiality is important to safeguard. Why? To safeguard privacy, a sense of security, restore confidence in the individuals who are impacted on, battered when a positive blood report is got. But importantly, it also promotes acceptance of the report, encourages them to disclose their status, their HIV status, protects them from facing the horror of discrimination. The confidentiality about the disclosure of identity of a subject has proved to be counterproductive and has resulted indeed in delay in the initiation of the antiretroviral therapy, and thereby the infected person continues to move around and infect others. So it's been found to be important here. NACO is now allowing all aided laboratories to receive samples and dispatch the report with the patient's name along with the code, so that these cases can be registered at with the centers and at an early date, and then have the follow-up done without delay. The amended Code of Medical Ethics from 2002 also states that confidential information revealed by a patient should never be revealed unless this revelation is required by the law of the state. A physician must also use his or her judgment to determine whether his or her duty towards society requires him or her to employ confidential knowledge obtained so as to protect a healthy person against this communicable disease. This is an important requirement and a fair amount of judgment from the physician's part. Now, we now talk about some of the ethics in clinical trials. The highest ethical standards must be upheld when collecting biological data on sexually transmitted infections, and this includes HIV/AIDS. Now, because of this stigma and human rights issue around this HIV/AIDS, study participants may experience psychological, social, physical, and also economic harm even when precautions are taken. Data collection protocols procedures should include an explicit description of the measures that will be taken to protect these subjects. Both the ICMR and the Central Drug Standard Organizations have established guidelines for biomedical and clinical research in India. Now, I'm referring and talking with regards to India because this is obviously there, and I am involved in a program, ethics program in many centers, 75 centers in India. Now, we're talking ethics and the HIV vaccine. Even the selection of the study sites for the clinical and vaccine trials are fraught with ethical complications. Sometimes researchers have chosen, often this happens, the researchers choose developing countries for such trials to avoid the ethical constraints, the rigor, ethical rigor that is faced in the developed world. HIV vaccine evaluation interfaces with behavioral and social sciences research in many ways. And for example, behavioral social factors can facilitate or impede trial conduct and eventual vaccine uptake, even if the vaccine candidate is effective. So that's something to keep in mind. These factors that I just alluded to include underlying perceptions about HIV, misconceptions about HIV vaccine research and its volunteers, and its effects on experimental vaccines on trial participants. There's also the socio-cultural and ethical legal context in which trials are conducted and past clinical and in fact have the past clinical trial experience. Vaccine research is a cornerstone of biomedical efforts towards HIV prevention and is inextricably linked with social and behavioral strategies, as whenever we look at a multi-level approach to prevention, a systematic framework that aims to identify and address issues arising before, during, and after the HIV vaccine trial is needed to integrate both the behavioral, social, and the HIV vaccine clinical research. Now, the next one is looking at people working with working with people who are affected with HIV/AIDS. There's a code of ethics requires that social workers strive to become and remain proficient in professional practice, and indeed the performance of professional functions. Social workers should critically examine and keep current with emerging knowledge relevant to social work. Accordingly, when work with HIV/AIDS affected people and communities, social workers should obtain training, consultation to promote awareness and understanding around the range of health and mental health issues of people living with HIV/AIDS. Not only the people, but their families, the communities, and the systems that intervene at the several levels of practice. In addition, these social workers should continuously update their knowledge about all aspects of HIV/AIDS disease, including the new prevention strategies, the new treatment models, medication regimes, and also the policies. Workers should also obtain education about and seek to understand the nature of the social diversity and oppression, including the disproportionate and disparate risks of transmission of HIV/AIDS in vulnerable communities. Practicing with cultural competency requires that these staff are working, healthcare providers or healthcare staff like social workers, to be aware that there are multiple structural barriers to the identification and treatment of HIV/AIDS, which include, above all, poverty, limited access to health, behavioral health care, lack of support for comprehensive sexuality education, irregular access to needle exchange programs, and several other prevention services, particularly when we are in the under-resourced community-based services. So, having looked at a number of these areas that come out in terms from an ethical perspective, we will conclude that the global burden of HIV infection in the years to come will be borne overwhelmingly by the people in the developing countries, right? Increasingly, inequalities of gender, race, and wealth will dictate the course of the pandemic, with infection rates increasing among the vulnerable group. Social and economic dependence will be a major determinant of the future course of HIV/AIDS pandemic, and input from social research field is urgently needed for planning and evaluation of AIDS prevention programs. And we see the social, behavioral, and legal research will improve the understanding of the dynamics of pandemic and its impact. It will translate into public health and indeed societal action for fostering understanding of the intricate relationships between, on one side, the individual, on the other side, the society and public health. All this the relationship, all through a good understanding will take place between these different domains: individual, public health, and society. And it will also help in resolving some of the complex social and indeed ethical issues that we see. Now there are some references here, which is there. So thank you very much for listening to me,
Thank
and
you,
we will now talk to
Russell.
KK. Yes.
Yes. Thank you, Russell. I'll take away some of the lessons learned from HIV and try to interpolate it with Corona and COVID-19.
Yes.
Why we don't have in pre and post counseling in Corona? That is also infectious. That is also harmful. That is also people can commit suicide when they come to know that they have Corona. Why all over the world, people have not come back to the ethics of consent in Corona? Because when you come to know suddenly that you are Corona positive, you may even commit suicide. It may come as a jolt. Why HIV? Why there is a discrimination between HIV and Corona? One is mandatory pre and post consent, and in another one there is no pre and post consent.
Well, I think there's a far more stigma and discrimination with the HIV. On the other side, on another front, probably the corona is far more infectious in terms of spreading. We know that in terms of HIV/AIDS, the infection, the transmission is.
There is some problem with the screen. In the meantime, we will have one person who can come and interact with Russell. We will allow, because the time is less. If somebody wants to interact with Russell, one person can come. The another issue is mandatory. The other issue is mandatory testing. In Corona, you have mandatory testing. In HIV, you do not have mandatory testing. Both are pandemics, both are different. And that's what we are trying to say, that every disease is different. Both are RNA diseases. In one disease, you don't have a vaccine and another vaccine is available. But one message which I want to give it to everybody is HIV today is preventable, manageable. It is possible to make it undetectable, and it is also possible to make it untransmissible. So if you have an HIV, you know the treatment today. We know the treatment today. We know everything about HIV today. And this tells us that the future is near us. We will also get a cure of corona sooner or later. You will have a good antiviral drug. Why vaccine has not been able to formed in HIV is because HIV virus enters the CD4 cells and hijacks the CD4 cells. Hijacking of the CD4 cells is the main factor why HIV vaccine is till today has not been able to form. Let's have one or two questions before I say goodbye to all of you. Yes, Hashmi, you want to ask anything?
सर मुझे ये पूछना था कि सर ने बताया कि कंसेंट करे बगैर आप HIV टेस्ट नहीं कर सकते
Law wise, legally,
इंडिया में
ethically,
अपने पास
yes.
हर हॉस्पिटल में हर मेजर सर्जरी से पहले विदाउट कंसेंट HIV टेस्ट किया जाता है हर पेशेंट को
आप
क्या ये
बिना
सही है
कंसेंट वहां पर भी आप कंसेंट देते हो, लेकिन आप पढ़ते नहीं हो. वहां पर भी आप कंसेंट देते हो, लेकिन पढ़ते
अच्छा
नहीं हो. आप बैंकों में जैसे साइन करते हो, बैंक लोन लेते हुए ब्लाइंडली साइन करते हो, वैसे भी हॉस्पिटल में आप ब्लाइंडली पेपर साइन करते हो, उसमें सब लिखा होता है. चलो, क्योंकि
अच्छा
डॉक्टर रसल अभी नहीं आए और हमारा पूरा 1 घंटा समाप्त हुआ, हमें एक ही सवाल यहाँ से लेना था. सो थैंक यू डॉक्टर रसल to be here with us, interacting with us on this particular subject. And thank you all my viewers. We'll be back tomorrow at 7 p.m. with another show. Tomorrow we will have our colleague from Bangladesh sharing all the corona findings in Bangladesh. Day after tomorrow we will have from Sweden. For the next 2 days we will have some international experiences on that. Thank you very much. Stay tuned and we'll see you tomorrow at 7 p.m. Namaskar.